where we are. On the COVID transmission, following the facts are changing as they learn more about this virus. There's less concern about surface area transmission, more data that it is primarily an airborne transmission. That then raises the question of what can we do with air filtration technology. You hear this is an air-conditioned building. It's bringing air up into the HVAC system, it then runs through the HVAC system and gets recirculated. What kind of filtration can you have on the HVAC system that may be capable of catching the virus as it's attached to the droplets? There are filters that systems install. HEPA filters are one of them, and then a series of filters that are rated by the minimum efficiency reporting value, MERV value. And the most dense filters can actually filter out the virus, which is remarkable and interesting. Nothing is simple with this virus. It depends on the air conditioning system you have whether or not it can take one of these higher filters and still operate. And different systems take different filters, and we're working through that now. We're spending time on it because I think there's a real possibility that we could actually have a positive contribution here. And different HVAC systems have different capacities, but we're working through this now. Because if there is a way to filter the air, and there's a way to get COVID out of the air, then we want to do that. And if we can do that without an exorbitant expense for existing HVAC systems, it's something we have to look at. So we're in the midst of that now, and as soon as we know something, we will make it public.